Another person deeply involved in treating or having to do with migrants is Anna Eichenberger. Thank you so much for coming here. She's a senior physician at the Inselspital, specialized in tropical and travel medicine, and she once was in Madagascar, I think, for several years. She will talk to us about the practical problems of hepatitis B and C experiencing also in their consultation or her consultation with migrants. Her topic, the barrier actually of migrants with chronic diseases to the healthcare system, the treating physician's view this time. Thank you so much. Yes, you have, as I heard you told me before, kind of a consultation once a week with migrants at the Bundesasylzentrum, the center for the migrants first coming, so to speak. Can you take me there? What's happening when you sit there, you have a migrant, woman or man in front of you, what happens?
So these migrants come to us to the doctor's consultation because they have acute issues. So the nurses are there from Monday to Friday. We only come 3 times a week. There is a doctor's team, and they would come because they have issues like everyone else, like you would go to see the GP, respiratory tract infections, GI problems. There's a lot of skin issues. I mean, we see lots of people, migrants with scabies. So they come forward. At the moment, we have diphtheria problem. We see some who reached a high score in their tuberculosis entry screening. So they get questionnaires when they register, questions like cough, etc. And they collect a score, and if the score is above 10, then they come to us. So I examine them, see if they have any signs for active TB. And then there's a lot of psychological issues, so post-traumatic stress disorder.
Of course. Yeah. And how in this consultation do you get to the point where you, I don't know, ask, do you have hepatitis B or C, or how do you introduce that topic?
We do ask if they have any known chronic diseases, which often they don't know, obviously. But then at the first consultation during that time, that's not really the
something to address.
Yeah, something to address the issue at that consultation. So there's a lot of there's so much else to address. The first problem is obviously the language. So we use telephone translators. So you would always have the telephone, the microphone, you, the person. So already you have this circle going on, and it takes a lot of time to even get to the issues which are acute at that moment. So hepatitis B, C, to talk about that, I often it would just be too time consuming. Obviously, if they have GI symptoms, anything else, then I try and begin and ask more, and then maybe offer screening.
So when does it come up? So when in what cases do you have to deal with that?
The ones obviously who know that they're HIV positive, they will come forward in the consultation with the doctors. So they will dare to disclose and say, so yes, I'm positive, I need my medication. Most of them are or have been on medication, so they know that it's important. But the ones who don't know, I mean, everyone is offered HIV testing, and they get told about HIV, there's condoms lying around, so they can come forward, but not many of them do. It's difficult in a center, right? Where also, like the others mentioned, your family might be there, your partner might be there.
Right, I just wanted to ask you, how open are they able to talk with you? I guess that's a little difficult in that environment.
Yeah, I think when they're with me alone, they are very open. But they also need time to be open, I mean, to develop trust. So sometimes I will take a lot of time to dig deeper when I have this feeling that maybe this abdominal pain is not actually what's bothering them, so I try and ask further. And there have been many occasions where then it turned around that all of a sudden they said, well, they broke down crying and said, actually, I just, it's just too much. I have my wife here, I have my kids here. I want to be there for them. I want to offer them a house, a job, money. So it's more these issues which might come up.
Okay. And so are there cases, or I mean, yeah, are there situations where at the end you decide that a testing should be done, a screening should be done?
Sure, yeah, definitely, yes.
But how do you get to this decision? Just your gut feeling, or they start to tell you about symptoms?
I mean, obviously, we heard we should be testing everyone who comes from high prevalence countries. So you could say, I should be testing everyone, which we don't. I can explain why we don't. So often I would only come to that point to actually screen when there is maybe something with the liver. So I do my liver tests, and then while I'm at it, I screen. I take the opportunity.
Okay. Yeah, maybe before I ask another question, I really want to know, why do you not test all of them?
So they only stay a maximum of 140 days with us. Usually it's about 2 months. And it's the point of entry, so where they seek their asylum, so everything starts. They won't stay, most of them not even in the canton. So they're placed somewhere else, they will go somewhere else. If I would start if I know, okay, he's chronic hepatitis B, then I need to go further. We need to get my DNA, we need to do a liver scan, etc. So this needs to be done in the canton. It's not the moment to really dig in. There is no, I mean, also the workload is huge for everyone there. At the moment we are full. There's about 450 people, 90 in, 90 out per week. And there is the risk of things getting lost. So we don't have a digital system, unfortunately. Ideally, it would need to be a nationwide system, right, where you'd screen, put your information in, they go to the canton, and it's there, the information, so it gets taken further. We are still working with paper files, and if they have medical issues, then they are tagged as yes, medical. And when they go to the canton, it also goes from state to cantonal level. They're given that file, but it's not a doctor who receives the file. So there is a social worker, and I mean, does she know where to put the patient? No. And then there may be, you know, in a different housing, and then they have to go see a GP. So again, it's a bit complicated. Yes.
A bit complicated. I would say it's very, very complicated. And I'm amazed, you know, not being in that system, that it's not digitalized. What seems to be the thing that needs to be done right now. I mean, the idea that you might see somebody that has a problem, at the end it just gets lost in the system, because wherever this paper or octet ends up, that's amazing.
Yes, and for some things, I think it's a chance lost. And for others, maybe they do have an acute disease. We had a lady who was treated for TB, and she got moved out to another center where there were not even nurses. And she had side effects, and she didn't know what to do. So it starts there. And this is someone who has TB who might stop taking her medication because she has side effects. Or another patient, she started on HIV medication, and she was out somewhere in, I don't know, in Europe, but it's about 2 hours by train, far away from the city. And we asked her to be placed very close to us. She was already transferred then to the Inselspital. She was being seen by us there. And even it didn't happen. She was, I think almost 2 hours by train. And and she came back a few weeks later crying, and she had to stop taking her medication. So it's a problem. And she didn't want to tell anyone. I mean, she would confine with the doctor, but not anyone,
Else
at the center, because of the stigma issues we heard about.
Right, wait, there are a lot of problems. So if you would have somebody at the center, then you know he has hepatitis, let's say B, would you treat him? I mean, would you make sure that he gets his medicine, or what would you do?
I mean, the first thing we check for the liver parameters, and if it's not, if it's normal, I would tend to, wait till they are in their canton, and then have them been seen by infectious disease specialist or hepatologist. It also doesn't make sense to send them to a specialist to start the workup and decide, does the person need treatment or not? And then in the middle of it, he gets moved away to another canton. So that also doesn't make sense.
Or
it's a waste
outside of the
resources.
country, or they leave the country.
Or outside the country, yeah.
So when we talked earlier, you talked about the dilemma also, treating these people that aren't here in Switzerland that long, maybe, leave soon. What is your dilemma there?
For me, it's an ethical dilemma, because I know I have the medication here. I mean, there's also the example of hepatitis C. Yes, we have the medication. We have a few asylum seekers from Georgia, for example, and they come and they know they are positive. Lots of them are or used to be IV drug users. They have a program in Georgia, so they come into our program, and they say, I have hepatitis C, please can I get treatment? So I know it's maybe 2, maybe 3 months treatment. We need a stable situation to start treatment. We need mutual trust. So it's not, again, it's not the moment to start someone on hepatitis C treatment. So I tell them, well, we have to wait till you're in the canton, knowing that the chance for him to get asylum here is super low. So that's the reality I know, and and that's a dilemma.
But what about if they had treatment over there, and now it would be interrupted, and that could cause a problem, a health problem? Wouldn't we all be responsible to actually make sure this treatment goes on? Or do I understand that wrong?
You are saying that we should maybe start treatment, but then keep them here?
No, continue the treatment, or they're not coming and having treatments over there. Like if they come from Georgia, are they treated? That was my question.
In their home country?
Yeah.
I think again, it's a problem of access to the treatment.
Okay, they mainly don't have access.
Yeah, exactly. Yeah.
Okay. Yeah. So actually, if I understand you right, it sounds to me a little. I mean, it's very difficult, because you don't have really a person in the canton like that you can hand over these people and say, look, this is a especially difficult case, or this person probably needs treatment, and can I hand it over to you, so to speak, in the canton?
It's definitely an issue we have been discussing. Yes, we were at the point about a year ago where we decided we need to meet these people, we need to talk to them and improve the system. And that's when the Ukrainian war started, and the State Secretary for Migration was so overwhelmed, and so are we at the moment, that these meetings didn't happen.
So it's getting worse, and it's not solved.
I think this next year is where we are trying to push it again. We all know about the problem. We have discussed it. It's
definitely needs to be
resolved.
Addressed. Yes, exactly. I'm sure we can talk some more about this, how to solve the problems later on in the panel that we're going to have shortly after with you on it too. And so I thank you very much. And we talk a little later, so
thank you.
We can have also from the audience questions to you.